Ko Wai Health, tētahi o ngā PHO Maori e whitu o Aotearoa, e whakarite ana i ngā tini rātonga e tika ana mo te iwi Maori.
Elbows in, push down. Get elbows into your sides, push down.
I have 22 to 25 people in this pool, in the 25-metre pool, and another 20 waiting to come onto the program. They also come in the mornings and they water walk. I also have my queer on the other side doing exercise in the hydro pool. There's about 5 or 6 of us.
I'm just so proud of our whānau too. We had a man with cancer in doing the water walking. Now, when he got too sick, all of the people in that group that we took would go around and towards the end they were going around and looking after him. That wasn't a health initiative, that was just what you do. So what's the difference between a kaupapa Māori-driven organisation? Well, there's a difference, you know. Doesn't matter who it, and this is a Dutchman. This was a Dutchman. Didn't matter, he was part of the whānau. Everybody turned up to tautoko him.
Bend over. 5.
We talk about whakapapa and whanaungatanga like it's a Māori-only model. I think really what's happened is Pākehā have forgotten where their models are. They've forgotten how they actually link into that stuff. Because solutions that work well for Māori work well for Pākehā too. We know it because that's what we do here.
We are a Māori kaupapa delivery service, and that's centred mainly around tikanga Māori, which incorporates our health model, which is te whare tapawhā. It incorporates the 4 corners of a person's healing.
Ko te taha he ngaro te wāhanga puare whakaro me ngā karearoto. Tatu atu ki te taha tinana, ki te taha whānau, ara ko te noho ngātahi me te mahi ngātahi a te iwi. Ko te aro mata waitanga o te mahi takitahi e hāngai atu ana ki tōna awhina ki te iwi.
A lot of our clients that come in have no support, but with the ones that do have, we try and work closely with their whānau, because we believe that the nucleus of their well-being starts from the whānau essence.
Hei whakakapinga, ko te taha wairua, ara ko te wairuatanga o te tangata, me te taha hinengaro, te taha tinana, me te taha whānau, kia puta ko te whare tapawhā o te tangata.
Our Christmas dues are wonderful, because then you actually get to see the evaluation of your workers. And this is another thing that's different. You know, for some people they call them performance development planning and performance appraisal. For Māori we call it poroaki. You know, for Māori we call it mihi whakamutunga. For Māori we call it whakakapi. And we're continually evaluating. So this is the other fallacy too, is that Māori services aren't evaluated. We would probably have some of the strictest evaluation settings in the world. Māori are very good at hui. We have to be, and especially at this organisation, because we hui a lot. We would, I have once a fortnight, I have a senior management team hui. Following that, the same week, I'll have a hui with all the community health workers. Once every 2 months, we'll have a hui with every single worker in Waipareira. We'll come together and we'll chew over the fat. Once a month, every Wednesday, once a month on a Wednesday, we have a hui with the whānau, where they give us feedback. So in terms of evaluative process and in terms of getting feedback, in terms of customer satisfaction and making sure that we're on target, we've got all of these methods available to evaluate that.
We've got to be more level-headed about our conduct with one another as we grow our skill sets and as we go up the food chain. And it's only been exposed to new opportunities that we understand them and grow with them. And sometimes, because we haven't been exposed to them, we've got major skill problems, and we turn those skill problems into personality problems. And so as long as we work due processes out where we can get a solution for the best possible outcome for our people, that's what we should be focused on. And then once you get over those sorts of things, you can then have a free and frank discussion with how much money has been voted to the Māori problem, who is getting that money and whether they are working well with it or not. And that's really the question, because at the end of the day, we're in business to lift health outcomes. So we lift education outcomes and we lift economic outcomes, and socially, economically independent people have absolute cultural dignity as well. You know? So cultural dignity is underwritten by economic and social independence. And if we can break away from low-skill workshops, and we can break away from poor education and a whole bunch of other things, the growth and strength of Māori-related matters just won't be a problem.
The minute you start to define us, you lose us, because we're so broad. What you do when you have an organisation of 160 Māori working together is you've got just about every combination of what a Māori is to deal to. That, of course, has its passions and it has its ups and downs. Because we get some people sometimes from Ngāti Porou who think they're the centre of the world, when we all know that the centre of the world is Ngāti Whātua. But, you know, even those jokes, you know, that kind of humour that we have with each other, you know, even that's all part of whanaungatanga. You know, what's whanaungatanga? Well, I don't know that there's a... ki tāku nei whakaro kauri he kōrero pai rotu i te reo tauiwi, e pānakai te whanaungatanga ki a rātou mā ko tēnā ko te nepotism.
Mā te aha a Wai Health e ahu whakamua. Nā te aro matawai ia no, o a rātou mahi aura, me te mahi tahi i te taha o te hāpori.
I think the aspirations for Waipareira here will be that for the first time in a city of 200,000 people, over the next 5 years, we should be rated on how we lift the outcomes for Māori children in lifting their numeracy and literacy at primary school, such that when they get to secondary school they are on fire, and such that Māori babies leaving secondary school have a whole vista of opportunities that they don't presently have, where 54% of Māori boys fail. And so so we must be rated on the outcome as a Māori organisation, because we can blame Pākehās forever, but we have to start taking some responsibility for positive outcomes in our community. Secondly, as we do that, we will drop Māori criminology going into the district court down here in Henderson and onto the High Court for worse matters. We'll also drop Māori abuse at 68% rates over here at Children and Young Persons Service, and we'll make a big bunch of social workers over here unemployed, which will be a really good thing for them. And so those are the sorts of aspirations we've got. They're very simple, but they're very difficult to achieve, but they're not unachievable. So those are the sort of very basic aspirations, but they have huge impacts in the benefit of our people.
There's so many things our people miss out on because they're too hakamā to ask, because health's a luxury to them, because the mokopuna will always come first. I won't look after ourselves. You know, our mortality rates are disgusting. And, you know, and they're disgusting because our people are still treating health like it's a luxury. It's not a luxury. You know, you're born of mana, you're born of tapu. That's the minimum. Excellent health should be your minimum requirement, your minimum quest.
Kei te mihi kia koutou o Waipareira. Ko koutou e tiaki nei, e awhina nei, I te hunga, I ngā whānau, I ngā kaumātua, me ngā tamariki katoa. Nō reira, ko taku mihi kia koutou.
But as usual, you know, our people want everything for nothing and they don't want to bloody pay any fees, and so it placed a lot of pressure on our financial situation, and it still does. So bloody pay your fees, you know, we're low, we charge low, but too many of our people want everything for bloody nothing.
He mea tau toko nā te manga.